Hello and welcome to Dateline Lagos on Channels Television. I'm Ayotunde Balogun. Coming up on the program, Lagos State Government to expand medical education infrastructure to tackle health workforce shortage. Governor Sanwo-Olu swears in 8 new permanent secretaries. And Lagos State Health Management Agency holds 2025 first quarter EKOSHA Town Hall meeting. In a strategic move to combat the critical shortage of healthcare professionals in Lagos State, the government has handed over 3 key medical infrastructure to contractors for conversion into modern academic facilities. Speaking at the Gbagada General Hospital, the State Commissioner for Health, Professor Akin Abayomi, says the expansion of Lagos State University College of Medicine and 2 COVID centers will help scale up admissions within the next 5 years. Please take a look.
The Cardiorenal Center in Gbagada General Hospital, which served as COVID isolation center in 2020, is one of the facilities approved by the Lagos State government to be converted into academic offices and tutorial lecture rooms for training medical students. Others include the Lagos State College of Medicine and COVID Isolation Center at Infectious Disease Hospital in Yaba, which will be transformed into large lecture theaters and multidisciplinary laboratories to accommodate the imminent increase in student admissions across critical medical disciplines. The State Commissioner for Health, Professor Akin Abayomi, who is at the Gbagada General Hospital alongside the Chief Medical Director of LASUCOM, Commissioner for Tertiary Education, as well as the Vice Chancellor of Lagos State University, are here for the official handover of the facilities to contractors. They emphasize that the initiative is in response to the severe shortage of human resources for health, exacerbated by outbound migration of medical professionals.
We anticipate, and according to the directives of the Lagos State Executive Council, who have approved a strategy for taking our numbers up from 200 a year to 2,500 a year in the next 5 years. That means that every year we have a target to expand our intake by about 500 and do it gradually and incrementally until we meet that target. It's an elaborate plan, and this is phase 1. Now, one of the requirements, as you will hear later, is that you can't just suddenly wake up one morning and decide that you're going to train more medical professionals. You have to go through a very detailed process of accreditation by the associations that ensure quality assurance of our graduates. And that involves a number of things. But the top 2 things are infrastructure, that you have enough space to admit an increased number of professionals. That's number 1, in a comfortable environment to do a variety of learning procedures, such as didactic lectures, tutorials, and laboratory space for them to learn their skills in the different cadres of healthcare training. A building and chairs does not make an institution. You now need the instructors, the academic lecturers who are going to teach the expanded number of students that you have. And so when you add infrastructure, you need to have the requisite number of lecturers to a requisite number of students as per the requirement of MDCN and National University Council. We anticipate, and according to the directives of the Lagos State Executive Council, who have approved a strategy for taking our numbers up from 200 a year to 2,500 a year in the next 5 years. That means that every year we have a target to expand our intake by about 500 and do it gradually and incrementally until we meet that target. It's an elaborate plan, and this is phase one.
A welcome initiative for those in the education sector towards addressing the human capital deficit in the health sector that will also help secure accreditation from regulatory bodies.
It is clear that in Lagos and Nigeria in general, there is need for us to expand the human capacity in the health sector critically.
Handing over this to the contractor, this building to a contractor, to get us the infrastructural needs for accreditation, and the other ones that you have visited at Yaba. I am very happy because we will be in a good position to, show the accreditation body that yes, we are ready.
The Chief Medical Director of Lagos State University Teaching Hospital, Professor Adetokunbo Fabanwo, describes the project as a long overdue response to Lagos' growing healthcare needs.
And I would like to assert and affirm that in all this, the single winner, the trophy carrier, is the Vice Chancellor of LASU. Because today, a lot of the headache she had in terms of infrastructure is being resolved. The meeting she referred to, the Court of Governors, I was there on Monday when we were brainstorming on the ways we thought about all sorts of things, PPP, etc., etc. Little did we know that, in fact, a big solution was already coming our way. We thank God for this development, and we pray that this day will mark the beginning of greater things to come in the health sector.
The state government says the medical infrastructure project will provide 1,600 additional lecture theatre seats, 1,600 laboratory spaces, and 110 new office spaces for lecturers and academic staff, which will help achieve academic excellence.
From health infrastructure to state governance, this time the Lagos State Governor, Babajide Sanwo-Olu, has sworn in 8 new permanent secretaries to various ministries and agencies. Now, Governor Sanwo-Olu urged the new appointees to exhibit unwavering commitment to good governance and ensure excellent service delivery to residents of the state.
The Lagos State Governor Babajide Sanwo-Olu makes his way into the Lagos House Banquet Hall, Alausa Ikeja, for the swearing-in ceremony of 8 new permanent secretaries who have been cleared for the position. Some members of the State Executive Council, as well as other invited guests, witnessed the oath of allegiance ceremony carried out by the 8 lucky ones.
In discharge of my official duties, except as is required for the discharge of my official duties, or as is officially permitted by the government, so help me.
One after the other, they received their oath of document from the governor.
Mr. Mahmoud,
The head of service, Mr. Olabode Agoro, says the appointment of the new 8 permanent secretaries was born out of the need to revitalize the state's policy implementation by ensuring efficient service delivery in the state.
The appointment of 8 new permanent secretaries by our amiable Mr. Governor, Mr. Babajide Olusola Sanwo-Olu, was born out of the need to revitalize the state's policy implementation apparatus in a bid to always improve on effective and efficient service delivery. As we all know, since the assumption of office of Mr. Governor, he has always demonstrated commitment to excellence, merit, fairness, and transparency in handling issues relating to the appointment. In handling issues relating to appointments into the position of Permanent Secretary in the State Public Service. This is evident in the screening exercise organized biannually for substantive directors on grade level 17 who are desirous of and eligible for appointment into the position of permanent secretaries. This was put in place to eradicate the incidence of lobbying for appointment into such an exalted position. For the avoidance of doubt, I would like to state for the record that the appointment of these 8 permanent secretaries was made from the combined pool of directors who participated both in the 2022 and 2024 merit-based screening exercise for appointment as permanent secretaries. Therefore, other directors on the waiting list should trust the process and be rest assured that it will get to their turn at God's appointed time.
One of the newly appointed permanent secretaries, Mrs. Aderinsola Olanrewaju, who usually takes the role of swearing in new appointees, assures the state government of putting in their best to achieve the Teams Plus agenda.
To thank Mr. Governor and his cabinet for the opportunity given to all the newly sworn permanent secretaries today to serve in the best public service in the country. We do not take, none of us here, we take the oath that we have taken today lightly. We understand the importance, and we pledge and promise. We have resolved amongst each other that we will take this oath and keep the oath to the letter as we have just been sworn in. We promise that we'll do our best in the realization of this administration's Teams Plus agenda towards moving Lagos State forward. We thank you all for coming. On a personal note, however, I remember sitting here last year, and Mr. Governor was saying, how many permanent secretaries have you sworn? That it will be your turn soon. And to the glory of God, the Lord has made it possible.
Governor Sanwo-Olu urged the permanent secretaries to maintain the highest standard of professionalism in making Lagos a model state for governance and development.
For us in Lagos, it's always a promotion of excellence, it's always a promotion of professionalism, it's always a promotion of best in class at all times. And this is another crop of 8 best in class public officers that have just been sworn in here as permanent secretaries. And so permanent secretaries that you know are the backbone of effective governance. Just about a week ago, I met the entire 69 of them at the Exco Chamber. And they gave me further assurances of not only their dedication to service, but their commitment to the public service of Lagos State. And I'm indeed happy that they're all seated here today. And at that meeting, I supported them more than even my own cabinet members. But you know truly enough that you are the drivers of policy implementation. You are the custodian of institutional memory, and you are the bridge between the political leadership, in which you need to also give them that recognition, political leadership and the civil service execution. Your roles demand not just technical expertise, but also a visionary leadership. You must be able to innovate, and you must have unwavering commitment to the ideals of good governance at all times. As you assume your responsibilities today, I urge you to embrace our administration's developmental agenda with a renewed vigor, and it continues to serve as the guiding light of the blueprint for delivering a sustainable development and prosperity for all Lagosians. With your new status comes higher responsibility, higher expectations. You are now the standards of public, not just here, but of public trust, and you must lead by examples at all times. We'll expect nothing less than that excellence, result-oriented leadership for which you have worked and have earned you to this position. Your work must speak for itself through impactful policies, effective service delivery, and measurable outcomes that we believe will improve the lives of our people.
The new appointees are Mr. Olanrewaju Bajulaye, Ministry of Arts, Tourism and Culture, Dr. Abiola Idowu, Health Facility Monitoring and Accreditation, Mrs. Aderinsola Olanrewaju, Citizens Mediation Bureau, Mr. Tajuddin Mahood, Ministry of Finance, Mr. Wasiu Agbabiaka, Civil Service Commission, and Mr. Adebayo Olayinka, Ministry of Wealth Creation. 8 of them now joins the pool of permanent secretaries running the affairs of Lagos State governance.
As part of efforts to strengthen universal health coverage in Lagos, the State Health Management Agency has held its 2025 first quarter EKOSHA Health Alliance Town Hall meeting for Health Districts 1 and 6. The permanent secretary in charge of the agency, Dr. Emanuela Zamba, says over 1.6 billion naira has been invested into the Basic Healthcare Provision Fund since its full commencement in 2022, with 133,408 enrollees recorded across accredited primary health care centers.
It's a town hall meeting at Bariga Local Council Development Area where the Lagos State Health Management Agency has come to enlighten the people about health insurance scheme and also discuss the benefits of EKOSHA Health Alliance. The event, which brought together community leaders, healthcare providers and government representatives, paved the way for deliberations on Lagos State Social Health Insurance Scheme, Ilera Eko, and the Basic Healthcare Provisions Fund, made available for the vulnerable group.
The Basic Healthcare Provision Fund, which is a fund and an initiative by the federal government, through which they provide 1% of the consolidated revenue fund from the federal government, and that money is shared amongst all the states of Nigeria based on the population size and poverty rate. This initiative commenced fully in Lagos in 2022, and thus far, Lagos State has received the sum of 1.694812.82 billion from the federal government, which has covered 133,408 enrollees so far. This initiative is being implemented in accredited PHCs across the state and has made significant impact in covering vulnerable lives, to which we do appreciate the National Health Insurance Authority. We do appreciate the federal government. Thank you very much. On the part of Ilera Eko and what the state government is doing, the equity fund, which also is 1% of the consolidated revenue fund, is being provided by the state government to cover the vulnerable. Thus far, and under the leadership of Mr. Babajide Olusola Sanwo-Olu, EKOSHA commenced in December 2022 and has covered 372,620 lives thus far. A total sum of 2,245,216,700 has been expended since commencement, and in 2024, Lagos became the first state of Nigeria to make equity fund a first-line charge. Please clap for Mr. Governor. It's not easy. He's very dedicated, and we thank him. Indeed, the allocation which we were given in 2024 of 1 billion has now been increased to 3 billion for 2025. So we hope to cover even more people this year. Beyond health coverage, LASHMA is also committed to empowering vulnerable residents by providing them with the tools they need to achieve financial independence. In collaboration with the Ministry of Women Affairs and Poverty Alleviation, in the year 2023, end of 2023, early 2024, 209 vulnerable individuals were trained in vocational skills and equipped to start their own businesses. This is a program that we intend to scale up and we intend to expand. We have already had one feedback session with these 209 vulnerable individuals who told us that the empowerment has made a significant difference in terms of their ability to be able to feed their families. We'll be having another meeting with them. I think that is next week. Where's the EKOSHA team lead? We believe that we'll get even more success stories for them. What we intend to do with this sustainable program is that when you are empowered, after we pay for you for 1 year or 2 years, after that, we expect you to be able to pay for yourself because you have been given some level of empowerment.
Representative of the National Health Insurance Authority commends LASHMA for its continuous engagement with stakeholders, which will help identify and resolve challenges affecting health insurance service delivery.
If we don't have an alliance, if we don't have engagements, the health insurance program flops. So the importance of constant engagement cannot be overemphasized. Through constant engagements, recurring complaints that slows down or hinder healthcare service delivery are trashed, and viable solutions are profiled. So that's why we're here, to trash those complaints, to trash those things that hinder the progress of health insurance programs. At the long run, what happens if you have constant engagement? It builds up the confidence of all the actors of the health insurance program. The beneficiaries are happy, the other stakeholders are happy, the health service providers are happy, and everybody is happy. The NHIA eagerly look forward on having everybody in Lagos take up any form of health insurance program, and more importantly, the LASUCOM. This will eventually get all of us to our ultimate goal of achieving universal health coverage.
One of the officials of the State Health Management Agency also educates the people about LASUCOM healthcare plan and the services attached to it.
Under the BSPF plan that is covered by NHIA, or is monitored by NHIA, so we have the primary care and the secondary care. Under secondary care, you can see the doctor, you can register, you can see the doctor for different, primary ailments like malaria, all the things that we know, cough. You can take your children there for immunization, for nutritional support or nutritional advice. You can do circumcision for your child. You can also do HIV testing or counseling. You can do that there. You can do different tests, malaria tests. You want to check your urine, you want to check your stool for one thing or the other. You can do that there. You can check your blood. You can do blood glucose test, your sugar test, blood sugar test. You can do that. Then there's also care for pregnant women. All right, called antenatal care. So you can do that there. And if you need to do a surgery for delivery, normal surgery and CS, everything is covered there. Then for illnesses or treatments that does not involve surgery, you have the right to stay hospital. You are entitled to 15 days of admission at the hospital. For those that will be that are surgical, the treatment that you need to cut them open, you can stay in the hospital. You're entitled to stay in the hospital for 20 days, in the plan. Then there's also treatment for children. When you give birth to them, maybe they're not crying well, they call this birth asphyxia. The child is entitled to care. Jaundice or anemia for the child, low blood. All right. Then also management of illnesses like hypertension, of diabetes, and all of those illnesses. It can be managed under this plan. Also for surgeries like appendectomy for appendix, surgeries for hernia, call it heniographies. Surgery if you have issues with for the men, maybe the issues with the phallus. We can do the surgery here.
The Lagos State government says over 300,000 vulnerable residents have benefited from Eco-Social Health Alliance since its launch in December 2022. 209 people have also been empowered by LASHMA just to ensure that Lagosians plug into the state health insurance scheme called LASUCOM, and government welcomes more collaboration to achieve universal health coverage in Lagos.
So this is what we call it today on this week's edition of the program Dateline Lagos. As always, thank you so much for watching. I'm Ayotunde Balogun. Remember, as always, obey all state laws and please live a healthy life. Till next time, it's bye for now.